Multiple sclerosis is a potentially disabling disease of the brain and spinal cord central nervous system. In MS, the immune system attacks the protective sheath myelin that covers nerve fibers and causes communication problems between your brain and the rest of your body. Eventually, the disease can cause permanent damage or deterioration of the nerves. MS affects an estimated 900,000 people in the US. So in this video, we're going to discuss multiple sclerosis management. The video is going to be amazing, so make sure you stick to the end. Patients with multiple sclerosis, MS, a disease of the central nervous system that disrupts signals within the brain and also the signals between the brain and body, will likely experience symptoms that may negatively impact their quality of life (QOL). MS typically presents in young adults aged 20 to 30 years with unilateral optic neuritis, partial myelitis, sensory disturbances, or brainstem syndromes such as internuclear ophthalmoplegia developing over several days. The prevalence of MS worldwide ranges from 5 to 300 per 100,000 people and increases at higher altitudes. Overall, life expectancy is less than in the general population, and MS more commonly affects women, female-to-male sex distribution of nearly 3:1, due to the complexity of MS and its disease burden. Multidisciplinary management that combines pharmacologic and non-pharmacologic strategies with patient education is necessary. Diagnosing relapses of MS in clinical practice can be difficult due to the multiple subtypes of MS, variations of symptomatology, and pseudo-relapses. Managing relapses also presents its own set of challenges. For example, evaluating if treatment is appropriate and determining which agent would be most effective for a patient if treatment is recommended. If you have MS, the protective layer of myelin around some of the nerve fibers of your brain, optic nerve, and spinal cord become damaged. It's thought that the damage is a result of an immune system attack. Researchers think there could be an environmental trigger, such as a virus or toxin, that sets off the immune system attack. As your immune system attacks myelin, it causes demyelination. This can go into remission as new layers of myelin form, but chronic inflammation can lead to scar tissue, which can result in lasting neurological impairment. MS isn't hereditary, but having a parent or sibling with MS raises your risk slightly. Scientists have identified some genes that seem to increase susceptibility to developing MS, according to a review of studies published in 2011. The diagnosis of multiple sclerosis should be made by a physician with experience in identifying the disease. Diagnosis should be based on objective evidence of 2 or more neurologic signs that are localized to the brain or spinal cord and are disseminated in time and space, that is, occurs in different parts of the central nervous system at least 3 months apart. Magnetic resonance imaging with gadolinium contrast, especially during or following a first attack, can be helpful in providing evidence of lesions in other parts of the brain and spinal cord. A second magnetic resonance scan may be useful at least 3 months after the initial attack to identify new lesions and provide evidence of dissemination over time. There's no cure for MS, but treatment is available that can slow the progression of the disease, reduce the number and severity of relapses, and relieve symptoms. Some people also use complementary and alternative therapies, but research does not always confirm the usefulness of these. Several disease-modifying therapies, DMTs, have Food and Drug Administration (FDA) approval for treating the relapsing forms of MS. These work by changing the way the immune system functions. A doctor may give some of these by mouth, by injection, or as an infusion. How often the person needs to take them and whether they can do this at home will depend on the drug. Most people with MS have a relapsing remitting disease course. They experience periods of new symptoms or relapses that develop over days or weeks and usually improve partially or completely. These relapses are followed by quiet periods of disease remission that can last months or even years. Small increases in body temperature can temporarily worsen signs and symptoms of MS, but these aren't considered true disease relapses. At least 50% of those with relapsing remitting MS eventually develop a steady progression of symptoms, with or without periods of remission, within 10 to 20 years from disease onset. This is known as secondary progressive MS. The worsening of symptoms usually includes problems with mobility and gait. The rate of disease progression varies greatly among people with secondary progressive MS. Some people with MS experience a gradual onset and steady progression of signs and symptoms without any relapses, known as primary progressive MS. Patient education is essential for achieving optimal outcomes for patients with MS and improving patient QOL. and should increase awareness of number 1, the disease itself and its progression, number 2, the signs and symptoms of MS, number 3, current treatment strategies and plan of care, number 4, the recognition and management of relapses, number 5, the value of treatment adherence and impact of non-adherence, and number 6, hope for the future. The management of active MS may be further complicated by the complex variety of pharmacotherapeutic options and, in some instances, by having to switch between agents and drug classes. Newer agents in development, example alemtuzumab, ocrelizumab, and lecanemab, offer the opportunity to expand the therapeutic armamentarium, although further long-term data are required to evaluate any safety concerns associated with newer agents. Often, rehabilitation strategies such as physical therapy and occupational therapy are very helpful in improving and maintaining normal function. Consultation with specialists such as urologists, psychiatrists, and pain management specialists may be extremely helpful. It's critical to exclude other diseases that can mimic multiple sclerosis, including vascular disease, spinal cord compression, vitamin B12 deficiency, central nervous system infection, example Lyme disease, syphilis, and other inflammatory conditions, example sarcoidosis, systemic lupus erythematosus, Sjogren's syndrome. Symptom-specific drugs can relieve spasticity, bladder dysfunction, depression, and fatigue. 5 disease-modifying treatments for multiple sclerosis have been approved by the U.S. Food and Drug Administration. These treatments are partially effective in reducing exacerbations and may slow the progression of disability. Medications can help slow or change the progress of MS. Medications and other treatments can also manage relapses and ease symptoms. Relapses happen when MS causes inflammation in the central nervous system. An attack is considered a relapse when it lasts at least 24 hours and occurs at least 30 days after a previous attack. Relapses can last for a few days to a few months. Mild relapses usually need no treatment. For severe relapses, a medication called a corticosteroid can reduce inflammation and shorten the relapse. High-dose corticosteroids such as methylprednisolone are usually given by IV. You may take a corticosteroid such as a prednisolone by mouth after that. The lower dose pills help you taper off the medication. Medications such as muscle relaxants, example baclofen, can help relieve muscle spasm. For acute attacks, corticosteroid drugs, example prednisolone, methylprednisolone, may be prescribed to help reduce the severity and duration of the attack. Plasma exchange plasmapheresis may be used for severe attacks if the use of corticosteroids is not possible or has not helped to control attacks. Plasma exchange involves the liquid part of the blood plasma being removed and separated from the blood cells. The blood cells are then mixed with the protein solution albumin and put back into the body. Exercise programs can help maintain muscle flexibility, reduce muscle stiffness, and aid recovery from attacks. Aids to assist with mobility and daily activity can help maintain independence. Maintaining healthy body weight and eating a balanced nutritious diet promotes overall well-being. They may suggest treatment with an antidepressant. People with MS who have depression can also be treated with antidepressants or therapy, such as CBT. If you often feel anxious or worried, you may be prescribed antidepressants or benzodiazepines, which are a type of tranquilizer that have a calming effect. Men with MS who find it hard to obtain or maintain an erection, erectile dysfunction may be prescribed medicine to temporarily increase the blood flow to the penis, such as sildenafil Viagra. This is provided by the NHS if you have MS. Relationship counseling or seeing a sex therapist may also help both men and women with MS who are having problems with reduced interest in sex or difficulty reaching orgasm. As the inflammation and damage from multiple sclerosis can interrupt normal nerve transmission in the brain and spinal cord, many symptoms can occur. Some of these may be transient and some may become permanent. Management of symptoms requires good communication between the patient and the MS provider, persistence, and often the expertise of multiple specialists. The major goals of symptom management are to maintain independent function and improve quality of life. Although medications are available to help with many symptoms, medications may be only part of the answer. Often, rehabilitation strategies such as physical therapy and occupational therapy are very helpful in improving and maintaining normal function. Consultation with specialists such as urologists, psychiatrists, and pain management specialists may be extremely helpful. Let us know your opinion in the comment section down below. This is all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Please click on the next video clip to watch for more health info. Thank you very much.